Hi everyone, a while ago I did a video titled Beginner's Guide to Tretinoin, and today I thought we would do an updated version of that video. It's about time. So today we're going to be talking everything prescription strength vitamin A, otherwise known as prescription strength retinoid, tretinoin, retinoic acid, or Retin-A. So if you are a complete novice to tretinoin, if you've never tried it before but want to start, or you've been using tretinoin for quite some time but you want a little bit more information on it, maybe you're getting some irritation and you don't know why, then hopefully in this video you will learn everything you need to know. So we are going to be going through exactly what tretinoin is, what it can do for your skin, where you can buy it, who shouldn't use it, which I think is incredibly important, the possible side effects, how to avoid them, and my guide on how to apply tretinoin safely, including a map on where you should put it. If you're new here, hi, my name's Gemma. I am actually a qualified beauty therapist and esthetician here in the UK, but I haven't practiced in a clinic for quite some time as my full-time job has been YouTube. I would absolutely love it if you would come and join the Pampered Wolf Pack at any point in this video. If you're finding it helpful or entertaining, click on that subscribe button and the notification bell so you don't miss any future uploads. So firstly, I'd just like to thank Dermatica for sponsoring this video today. Dermatica are a prescription skincare service that provide powerful prescription skincare formulas that are personalized to your specific skin needs and your specific skin goals. Whether those goals be anti-aging, whether you want to reduce acne or blemishes or breakouts, whether you want to reduce acne scarring, whether you want to treat melasma, rosacea, or hyperpigmentation, they will have a formula for you. And another reason why I've been with them for so long, not only do they have amazing formulas that have transformed my skin, and I will show you some before and after pictures in just a second, but they can also create a formula that treats multiple concerns. So instead of having to buy 10 different treatments to treat all your concerns, you can save time and money by only having to apply 1 or 2. If you do decide to become a member, Dermatica's dermatology team will also check in with you regularly to not only make sure the treatment is still working well for you, but they'll check to see whether you're having any problems and whether the product's current strength is still appropriate for your skin. Now, the one thing I will say is this is a marathon, not a sprint. Don't be expecting to see results overnight. That is not going to happen. If you expect that, you are going to be disappointed. Most people start to see results around about the 3 to 6 month mark. Now, I know I've shown you before and after pictures in previous videos, but you know what? I'm going to show you them again because I think my results are really impressive. I'm really proud of my skincare journey and I think my results speak for themselves. Now, the last time I showed these before and after images, I got comments like, well, that's obviously not a fair test because you've quite obviously got makeup on in your after image, whereas you don't have makeup on in your before image. Let me tell you, I do not have makeup on in either of those images. My skin has just improved that much. Did you see the bags under my eyes on the after image? Prescription skincare will do nothing for the bags under your eyes. Unfortunately, that's the one thing it will not touch, but it has made my skin 50 times better than it was. Probably more. So if you do fancy trying out Dermatica for the first time, I do have an offer code for you, which I will put in the description box. It will allow you to get your first treatment for only £2.90 and your second treatment 10% off. So let's dive straight in. What is tretinoin? Well, tretinoin is a vitamin A derivative. It comes under the retinoid umbrella. There are lots of different retinoids. You will have heard of retinol. You will have also heard of retinaldehyde, sometimes shortened to retinal. And then you've got prescription strength retinoid, which is tretinoin. Now, tretinoin itself has lots of different names and they all mean the same thing. So if you've heard of prescription strength retinoid, prescription strength vitamin A, retinoic acid, tretinoin, or the brand name Retin-A, all the same thing. They all mean the same thing. It's the ingredient tretinoin. So what can tretinoin do for your skin? Well, tretinoin for me is the magic ingredient. It is the gold standard of anti-aging and it's been proven to work by scientists. It's basically the time machine for the skin cells that are able to reverse skin damage. Unbelievable stuff. So tretinoin will speed up cell turnover and increase increase collagen production, decrease fine lines and increase skin firmness, smooth skin texture, which has been amazing for me, decrease pigmentation, really evening out the skin tone, reduce inflammation and increase skin glow, and decrease acne, breakouts, and also decrease acne scarring. So who shouldn't be using tretinoin? Who will be deemed a tretinoin no-go zone? Put it down, stop using it, step away. It is not for you. This is incredibly important. If you are pregnant, trying to get pregnant, or you are breastfeeding, you shouldn't be using tretinoin. Now let me just explain, that is not because it has been proven to be unsafe for you, your unborn child, or your newborn baby. It is because there isn't enough evidence to suggest that it is safe. So if you've been using tretinoin and you've just found out you're pregnant, do not panic. It will be okay. Just stop using your tretinoin now. Everything will be fine. Other people that should reconsider trying out tretinoin for the first time are those that suffer with dermatitis, eczema on the face, or other skin conditions. If in doubt, ask your dermatologist or your GP. So where can you buy it from? Well, I've already explained that I get mine from Dermatica. They have been amazing for me, and those regular follow-ups really help. But some countries you can just step into a pharmacy and buy it over the counter. Other countries you will need a prescription from your dermatologist or your GP. So let's talk possible side effects. Now, some of these you definitely will notice, and others you may or may not get, and I'll talk about those in more depth in the next section, which is how to prevent those side effects from happening. By using tretinoin, you are going to thin the very outer layer of the skin, which is called the stratum corneum. It is not true that by using tretinoin you thin your skin over time, which causes damage. That is just not true. In fact, it is the opposite. Although it thins the outer layer, the stratum corneum, which is the bit of the skin that stops the nasties coming in and stops the good stuff going out, which will not be a problem if you treat it right, tretinoin use will actually help to thicken the epidermis and the dermis over time, which will really help your skin out. So it is just not true that by using tretinoin you are thinning your skin. It's just that very outer layer. But you need to know this to be able to treat your skin well. By using acid exfoliators, you are going to further thin that stratum corneum, and it might be unnecessary to do so, and you may over exfoliate your skin. Also, some procedures that you have had in the past will no longer be appropriate for you. So waxing is one of those. Because your stratum corneum is already thinned, every time you have a wax, it rips off a little bit of the stratum corneum, which isn't usually an issue because you've got plenty of stratum corneum to go around. But if you're using tretinoin, that stratum corneum is thinned, so there isn't as much. You will rip off skin and it will scar. So be very careful. Always let your technician know, and I know this from experience, that you cannot have a wax if you're using tretinoin on your face. Other side effects that you may notice, and I'm gonna read these out because if I miss one of these, I know you'll all come for me in the comments section. Irritation and soreness, some redness, dry, flaky skin. You could also see skin shedding, which can be really irritating, but I'll move on to that in a second. Eye sensitivity and eye soreness, especially around the corners of your eyes. Brow thinning. A lot of people don't talk about this, but I seriously noticed when I first started my tretinoin use that the inners of my brows were seriously thinning. I thought it was hormonal. It was actually from my tretinoin use. So you just have to be a little bit more careful where you're applying it. And again, I'll talk you through that in just a second. You may also get some skin itchiness and skin burning, and you may get some extra sun damage if you don't wear an SPF. But again, we'll talk about that in a second. You all know I'm gonna. So let's talk about those side effects that can be prevented. Number one, sun damage. Let's get this out of the way. You all know I get on my high horse when we talk about SPFs. I just can't help myself. Everybody should be using an SPF on a daily basis if you are stepping outside or sitting near a window of a factor 30 or above. And that is even more important if you are using any active ingredients within your skincare routine, especially tretinoin, because tretinoin is essentially there to reverse skin damage. And 95% of skin damage is caused by UV exposure. So essentially, if you're not using a sun cream alongside your tretinoin, you're using your tretinoin to reverse skin damage whilst creating more skin damage. Doesn't really make sense. It's a little bit like trying to drive a car uphill without an engine. You're not going to get anywhere fast, and quite frankly, you'll probably end up going backwards and your skin will look worse, not better. So tip 1 to prevent the side effects: you need an SPF. If you are not willing to wear an SPF, do not start your tretinoin journey because you are wasting your money. Tip 2, if you don't want to get any irritation, redness, burning, itchiness, don't apply too much. A lot of people apply tretinoin like they do their moisturizer and slather it all over their skin. It's not necessary. You need a very small amount. Remember, it's potent. It is really, really potent, so the smallest amount will go a long way. Tip 3, again, if you don't want that irritation, redness, soreness, you need to build up your tolerance. And quite frankly, if you haven't worked your way up through the retinoids previously, if you haven't tried retinol already for a good few months and then moved up to retinol for a good few months, I wouldn't recommend that you start tretinoin and jump in with both feet. And definitely don't start tretinoin on a high strength, regardless of whether you've moved up through the strengths of the retinoids previously. You're not going to do your skin any good. You need to be patient. And I know it's so hard because we all want everything. We want it quickly. We want it now. We want to see the results. But you're just going to put your skin through way too much stress. It's a little bit like eating chilies. Now, I love a bit of spice on my food, but would I jump into the fieriest, hottest chili immediately? Or give Beatrice or Seth a really fiery hot chili? No, I wouldn't. I'd build up their tolerance to that little bit of heat on the tongue first. Maybe start them off with a jalapeno, move up to a little green chili. I wouldn't jump in to, something super strong immediately because their bodies will not be able to cope with it. And that is the same for tretinoin. You need to be kind to your skin. You will see the benefits. Just work slowly, have patience. It will come. When you first start using tretinoin, I would firstly go to somebody who will give you the aftercare that you are going to need. I don't recommend that you go to a pharmacy and buy it over the counter because you're just not going to get those follow-up consultations that you are going to need. So I would go to somebody reputable to buy your tretinoin, and I would start on a low strength, and they will be able to advise you on what strength to start on depending on your retinoid journey before. They will either point you towards a 0.01% or a 0.025% to start off with. Then start off by using your tretinoin only 2 nights a week. Build up your tolerance, move on to 3 nights a week, then 4 nights a week, and so on until you're using it every single evening. Once you can tolerate using it every single day, you can then move up strengths in tretinoin. But once you've moved up to a higher strength, the process starts back at square one. Only use it 2 nights a week and build up tolerance to 3 nights a week, 4 nights a week, and so on. It's a bit of a process, but your skin will thank you for not jumping in with both feet. Tip 4, never apply your tretinoin to damp skin. Your skin needs to be dry. And I understand the reasoning behind wanting to have a damp face because so many people say, and it's true, that if you apply your skincare to a damp skin, it will aid absorption. The product will be able to get deeper a lot quicker and do its job faster. You do not want that with tretinoin. This is a fiery ingredient, and the faster it works, the more irritation you are going to get. You actually want to slow the absorption down a little bit in order to make sure that you're not going to get any of the side effects that I've spoken about previously. So definitely don't apply to a damp skin. Tip 5, to avoid side effects, be incredibly careful where you're applying your tretinoin. Now, I am going to show you a facial diagram in a second. Yes, I have drawn on my face. I do not want you to laugh at me. I am doing this for the greater good. I am happy to make a fool of myself in order to steer you out of harm's way and those nasty, irritating side effects. So here we go. So you can see I've drawn a line around the perimeter of my face. I apply the tretinoin inside that line. No tretinoin goes outside of that line towards my hairline and below my jawline. You will also see that I have a very Mickey Mouse shaped line on the inside of the perimeter line. I do not apply any tretinoin on the inside of that line. It all goes on the outside of that line, and for very good reason. So your skin is like a sponge, and when you apply any sort of serum or cream onto your skin, it's not going to be absorbed straight down into the skin. It's going to absorb outwards and downwards. So you are going to get migration of the product. The reason I don't apply around the corners of my eyes, around the corners of my nose, and the corners of my mouth is those areas are sensitive areas anyway, and they're also tretinoin stoppers. Once the tretinoin reaches that area, they have nowhere else to go, and they pool in that area, so you get more product around that area, and more product means more irritation, redness, and just nasty, sore skin. So if you apply a little bit further out and don't go right up to the corners of the eyes, corners of the nose, corners of the mouth, the product is still going to migrate to those areas, but it won't be able to pool. And if it can't pool, you're less likely to get that irritation and soreness. You'll also notice that there is a line around my jaw. It is not recommended to apply tretinoin to your neck. I know there are some dermatologists that do recommend it, and if you are under one of those dermatologists, then you should do what your dermatologist tells you to do in the way they tell you to do it. But I have been advised not to apply it to my neck. Usually you get a lot of irritation, soreness, and it can create some crepiness on your neck. Some people do it and say they've got great results, but again, it's not recommended. You'll also notice that I don't apply my tretinoin right up to my hairline and around my brows. That's because by doing so, you can create brow thinning and hairline thinning as well. So just be careful you're not getting it all the way up to that point. You will still get migration of the tretinoin, so you will get all the benefits of the tretinoin around those areas, but by not putting it right up to the hairline and all the way around the brows, you're going to prevent that issue from happening. Tip 6, I know I mentioned this earlier, but I want to mention it again in this section. If you are a big fan on exfoliating your skin, especially if you're one of those people that feels like their skin can tolerate exfoliating your skin daily, I would stop doing that. Remember what I said earlier on about the stratum corneum thinning over time with the use of tretinoin. You may find that you don't need to exfoliate your skin as often as you're used to. Once a week may do you fine, even less. I only exfoliate my skin once every 10 days now. Tip 7, and this is super important if you are just starting out your tretinoin skincare journey, or if you've been on tretinoin for some time, you're getting irritation and you just don't know why. My recommendation is to make sure you're using tretinoin on its own with just a generic moisturizer. And what I mean by a generic moisturizer is a moisturizer that its sole purpose is to moisturize the skin. No other active ingredients in it whatsoever. By doing it that way, you make sure your skin can tolerate the tretinoin before you start adding other active ingredients into the mix. So definitely do not mix any acid exfoliators, any vitamin C's, and definitely no other retinoids into the mix. No retinols, no retinals, just leave them all alone. By all means, you can put vitamin C and an acid exfoliator in your morning skincare routine, but for the time being, until your skin can tolerate it, leave them out of your evening skincare routine and just use your tretinoin and a moisturizer, and that is it. There is no reason why in future, once you know your skin can tolerate tretinoin, why you shouldn't add a few of these active ingredients into your evening skincare routine, but I personally don't. I just think it's safer using a really potent active ingredient completely on its own. It just takes out all the questions out of the equation. Tip 8, use the sandwich technique for application. This works wonders. It's extremely effective and will really protect your skin against that irritation, redness, and soreness. Find a moisturizer that is water-based, not too thick, heavy, and occlusive, and doesn't contain any other active ingredients. So just contains those ingredients that are going to moisturize the skin. Apply a thin layer of the moisturizer all over the skin. Then you need to let that sink in and dry down for at least 10 to 20 minutes. Once that's dried down, down. Then you can apply a thin layer of tretinoin over the top in the areas that I mapped out earlier on in this video. Again, let that dry down for a further 10 minutes and apply another moisturizer over the top, which can be the same moisturizer as your first moisturizer layer that you applied, or you can choose a thicker, more occlusive moisturizer if you feel like your skin needs a boost of hydration and nourishment. The purpose of that first layer of moisturizer is to create a cushioned buffer for your tretinoin to slow down the absorption process. Now, you are still going to get 100% of the benefits of your tretinoin. You're just going to slow down the absorption. And by slowing down the absorption, you are decreasing the risks of irritation and aggravation and redness and soreness. It's a little bit like a punch in a boxing match. If you're not wearing gloves, that punch is going to hurt a lot more than if you provide a little bit of a cushion pad to whack somebody in the face. Maybe that's not a great analogy, but you know what I mean. This second layer of moisturizer will seal everything in and provide the nourishment and hydration that your skin is going to need. Even if you have a really oily skin, I recommend that you apply it in this way. You don't need to apply a heavy moisturizer as your last step. A light moisturizer will do, but I definitely recommend the double moisturizers to sandwich that tretinoin in. And my final tip for swerving those nasty side effects is very, very simple. Listen to your skin. You are the expert when it comes to your skin, and your skin is not going to lie to you. If your skin is telling you that it is upset, it is a little anxious, it's a little angry with you right now, listen to your skin. Take a step back, take a little break, reassess. So what if you're doing all those preventative things and you're still getting that irritation and those other nasty side effects? What do you do then? Well, firstly, don't just ride through it. There are so many people that say, oh, you've got to ride through it, no pain, no gain. No, stop. Please don't do that. That is not how you deal with skin. Yes, of course, there's going to be some skin shedding. Yes, you know, there might be a little bit of dryness here or there that you can treat with a moisturizer. If your skin is angry, if your skin is annoyed with you, if you are getting upset with how your skin is looking, stop. Take a break, take a little rest, treat your skin, let your skin heal, and then reassess the situation and start again from scratch. And what I mean by that is there may be a need to lower the strength of your tretinoin. There also may be a need to lower the frequency that you are applying your tretinoin. And there may be a need to stop the use of tretinoin altogether and move on to a lower strength retinoid like retinaldehyde or retinol. If you're getting dry, flaky, shedding skin, whatever you do, do not peel it off physically with your fingers. Do not use acid exfoliators to try and get rid of it faster. Do not use a scrub to try and get rid of it. Don't rub it with a towel. Please don't be aggressive in any way to your skin. Your skin's doing that for a reason. If you want to apply makeup on those days where you've got that dry, shedding skin, and it does happen, massage your skin with a little bit of water to soften that skin, and it will come off with a bit of gentle patting to make makeup application more reasonable. If you don't like applying water to the skin, or if that hasn't worked for you, apply a little bit of moisturizer or a little bit of facial oil and massage the skin with that facial oil or moisturizer, and hopefully that will soften those flaky bits and allow the removal of those in a much more gentle way. But do not be aggressive with your skin. Your skin is just going to want to punch you in the face. And finally, if you do have those areas of dryness, flakiness, a little bit of irritation that's not unmanageable for you, try switching up your moisturizer. Even if previously you've had really oily skin, try using an occlusive moisturizer, something really heavy that's going to seal in the skin, that's going to protect the skin barrier, seal in all that hydration and really nourish. That will help you out, because after tretinoin use, your skin can change quite dramatically. Even if you've had, like I said, really oily skin in the past, you may find that you're getting small areas of dryness. So definitely reconsider what moisturizer you're using. So that's it for this video. I really hope you found it helpful. Like I said, I have added timestamps to the video, so if you do need to come back in and view it again at certain points, you will be able to find those sections more easily. Please don't forget to like and subscribe, and I hope to see you all in the next video. Bye everyone.